He's a go-getter, that's for sure.
Got it.
Okay, you ready?
Yeah.
Okay, don't laugh at me when I do this intro. Okay, folks, welcome back to another episode of the R2 podcast. Today we are joined by University of Western States alumni and fuck, let me restart. What should I even say?
No. Um, University of Western States alumni and
Current
yeah,
doctorate.
current, yeah, doctor of chiropractic, whatever, in Portland, Oregon.
Yeah. Okay. Hey, folks, welcome back to another episode of the R2 podcast. Today I'm joined by Dr. Tyler Johnson. Tyler is a UWS alum out here in Portland and currently works with Dr. Snell at Solutions Sport and Spine. How's it going, Tyler?
Doing all right, Connor. How are you, man?
Doing well, thanks.
Good.
It's always awkward doing these intros, so I appreciate you bear with me through that.
I was trying to hold my smirk in, but it's hard.
It is hard. Yeah, you didn't do a very good job. Um, so for all of our fans out there, give us a little rundown on who you are, where you came from, maybe a little background into what school looked like for you in undergrad, and just to pack on a couple more things like how did you get into chiropractic and what brought you out to Portland?
Yeah. So I went to school at Gannon University. My roommate in college was somebody that people who listen to this podcast probably know. Corey Bailey. He's a good friend of mine. Been
Mhm.
friends for a long time. Played college football at Gannon for 5 years. I was a running back, and majored in sport and exercise science. 2 years for 2 years after I graduated, I coached running backs at Gannon University, and was also um, a strength coach there as well. I had my CSCS at that point in time, so I was doing mostly personal training, working with athletes one on one. But yeah, I the first time I ever went to a chiropractor, I actually have not been to a chiropractor a whole lot in my life, up until school. And I remember I was maxing out on a squat in the summertime during training. I think this was maybe like my junior year, and I hurt my back. I was 21, I think, at the time, and went in there, and it was a little more traditional. Got an adjustment, and 2 days later, I was, back doing what it was that I needed to do. Um, but yeah, you know, I wasn't the greatest student in undergrad. I kind of got by, and um, but I knew what I liked to do, um, but I didn't really know where I was going to go with all of it. Coaching college football was a lot of fun, but I worked hard enough to graduate from undergrad, and I felt like I wanted to do more. And I remember talking to Corey one day, and he's like, "Hey man, I'm going to Logan. I'm going to chiropractic school." I said, "Chiropractic school," and I've been friends with Corey for a long time, and I always kind of trusted him. I didn't know what I was going to do, but I was like, Corey's got his head on his shoulder. He's got good head on his shoulders and everything, and kind of followed his path. But we had been friends for such a long time. I said, you know what, man, you go to St. Louis, you go to Logan, I'm gonna go to Portland, and we'll part ways here, but we'll always have that bit of a connection with the profession, which is really cool. It's really cool to be able to talk shop with one of your best friends. So had full intentions of moving back to the East Coast when I first moved out here, and I love telling this story to especially to Dr. Snell. I don't know if I'm allowed to swear on this, but anyways, Corey.
No.
All right, Corey goes. He goes, dude. He goes, when you go out to Portland, he said you have to find Doctor Snell. And I said, who? I said, who is Doctor Snell? I had no idea who this guy was. And about 6 or 7 months into living here, Chris Dominic, who was a past rep, um, had gotten some tickets from Doctor Snell for a Dan John seminar. And I walk in, um, and Doctor Snell introduces himself to me. I said, "Oh," he said, "You're the guy you're the guy that I'm supposed to meet. I said, I don't know anything about you, but you're the guy that I'm supposed to meet. Um, and to that, Dr. Snell, our paths cross again. I dog sat for him a little bit whenever I was in chiropractic school. We started to talk a little bit more. I was an R2P rep at that point in time, which piqued his interest, and I started shadowing him pretty much any opportunity I had. And he had an associate position that was going to become available around the time of my graduation, and um, things just kind of worked out. Things I don't know how I got here sometimes. I still have to write that down and work through all that, but I'm grateful that I'm here. So it's cool. It's cool. And now I'm working, full time Monday through Friday, and got a good schedule, got um, a lot of variation within my schedule. So it's cool to be in a clinic where I get to wear a lot of different hats, from a coaching perspective, where I still hold my CSCS and I can coach and program and work a little bit more into like a Rich Holmes sort of situation, but also I'm over here and you know a bit of the pain management side of things as well, the treatment side of things. So I'm still learning how to blend all of those things, but yeah, it's been a really cool experience, and I'm just glad that I did all the things that I did leading up to where I'm at now.
Absolutely. That's a cool story. And I think we owe Dr. Snell thanks for, I mean, that's how we became acquainted too. He's always been such a huge, uh, a huge help and mentor with a lot of that side of things here in Portland and the West Coast and stuff. And he's never ever denied us his time or anything like that. And he's always been super helpful. And yeah, I think I
He's a
definitely
good,
owe a lot of,
yeah, he's a good human.
yeah, yeah, probably the best way to put it.
Yeah,
Yeah, he truly wants the best for other people. And yeah, so I definitely owe a lot to him as well.
yeah.
Um,
There's no idea of scarcity in his mind. It's about bringing everybody else up with you. So it's a good, like I said, it's a good place to be. It's a good clinic to be associated with.
yeah, and a good mentor to have. It's a good path to follow. Sometimes I find that some people in this profession, it definitely gets a little more greedy, cynical. Some of the attitudes aren't the best, and so it's a breath of fresh air for sure.
Yeah, absolutely. And I think it's a good intro, as a young doc, to be put in that environment. You can kind of go down that path, right? You're gonna kind of follow your mentors, surround yourself with good people, and good things kind of happen. So that
Hmm.
was the biggest thing for me getting into this in general was, you know, Dr. Snell, I always felt taken care of by him, and I knew that if I was an employee of his, that he would take care of me more than just the employee side of things, but take care of me as a friend as well.
Yeah, that's awesome. That's rare in this profession too.
100%,
Yeah.
100%.
So rewinding a little bit, um, I mean, you were doing your strength and conditioning, yeah, ties with Corey Bailey. What got you into RTP? Like, how did you find RTP?
I will like, and here's the I probably have never even said this to Corey out loud, because he probably wouldn't even appreciate it if I told him, or he would just kind of brush it off. That's just kind of Corey's nature. Um, but I kind of just followed Corey's footsteps. Like, he said, I'm going to He's, calling him saying, how's school going? He's like, oh, I'm going to this club, MPI. I'm going to this club, R2P, and, asking him more questions about that stuff. And him and I actually, we worked at the same PT clinic when we were back in Pennsylvania. Like, he went off to school, and then I kind of took over his job, and then I went to school and everything. And so him and I, between, having a CSCS and then also having that, spending a good quality amount of time at a PT clinic, building, having some idea about rehab, walking in there, kind of just, I wanted to see what it was about. I wanted to see if, do I know this stuff? Do I know as much as I think I do? and what else is out there? And I remember walking into like the first meeting, and they start talking about um, clinical audit process. And I said, what is that? And they start talking about
You're like, that's cap.
no cap, no cap. And they said, and then they start talking about McKinsey and neurodynamics, and it kind of opened up this whole world to be like, oh, it's not always about exercises.
Yeah.
Exercises are great, but learning that, at the beginning, right, McKenzie and neurodynamics always seems like a treatment. And then as you kind of further, it turns into assessment. So, you have a different way of looking at the body, right?
Mhm.
And that's the cool thing about R2P is, it brings together all of these things, right? From there's all these different lenses. That's what I always feel like I'm talking to patients about. They're like, oh, well, my PT said this, and I said it's the lens, right? Um,
Mhm.
we're talking. You go to a massage therapist, they're gonna talk to you about muscles, right? Chiropractors are gonna
Yeah.
talk about joints. It's all about the lens at which you look at it. So even just going to R2P and expanding all of these different rehab systems, it just gives you a different lens to look at the body. Um,
Yeah. It's like when you're at the eye doctor and they're like putting all the different, focal lengths on there, like, how about this one? How about this one? And you're like,
yeah,
you're kind of just,
you
yeah,
mix and match, and you got to kind of figure out which one's going to work best for this case. And
totally.
then, and that comes with time. But I think it was eye opening to realize that, not all knee pain is, going to be taken care of with, lateral squat walks and, you know, and clamshells, which was very typical in the PT clinic that we were at. And you know what? For the amount of people that came through that clinic, a lot of them got better.
Yeah.
So, um, so I say that to say that, those exercises, they do work. Are they my thing? Is it where I'm going to go first? Probably not. But, now that I know what I know, but when I first walked into chiropractic school, oh, you got some, oh, you have a weak glute med, you have knee pain here, try this. And you know what?
Hmm.
People got better. And I thought that I was, thought I knew it all. And then you
Yeah.
start thrown into all these different systems, and it's like, oh, I actually don't know anything.
Yeah. 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 I can relate to that. So how did R2P, like, walk me through how R2P helped you get through chiro school and how it's helped you as a doc now? Besides, I mean, you can even talk about some of the connections you made, but just, the way you think, maybe even just like your mindset in school. So these episodes we're doing right now, we're talking to current reps and recent past reps, and we're like, hey, why is this a good idea for someone to get into while they're a student?
Yeah. I think, I call it fortunate or unfortunate, however you want to look at it. I believe I was about a year, a little over, maybe 15 months into the program before COVID had set in. Um, and, you know, we like R2P, the, executive board and everything, they were trying to they were trying to offer all of these opportunities. And it was kind of nice. From a perspective that it slowed things down. I wasn't in class all day. I was mostly sitting at my kitchen table, with lectures. But I was also, taking other courses as well. And I got to play around a lot when I was in those situations, being in my apartment all throughout the day, and also having a roommate that was also in chiropractic school. I got to play with a lot of different things and kind of see what worked for different presentations. So I got to tinker a lot, which I find that I still do sometimes. Even when I'm in the clinic, sometimes I can shoot from the hip a little bit and tinker, and that's my own curiosity. Which at the end of the day, I hope the person in front of me gets better because of that tinkering. But I wouldn't have been. I would have been in this box, right? I would have been in this box of lateral squat walks and clamshells and things like that. If it weren't for R2P, it expanded my ability to play around with things, and again, just different lenses, and oh, is this a joint? Is this a muscle? Is this a nerve? Is this, what is this? Is this something upstream? Is this something downstream? Is this something high, top down? Learning all of these different things, and giving respect to each of them as well as you go through it, as you go through just looking at a person and their experience, right? Because yeah, if you just somebody tells you their ankle hurts and the only thing you have in your toolbox is to adjust, then that's the only way that you're ever going to look at it, right? And ankles can get better with adjustments and mobilization, but um, for me, that's not as fulfilling. So I think R2P, to sum that up, R2P has made my work more fulfilling because I feel like I can help a ton more people, um, people who have chronic pain. Because even, the pain science side of it, is a part of R2P. That was a huge lecture, a huge point of this past symposium, right?
Yeah.
So, pain science is still R2P. And I think, that's the expansion that R2P can give you.
Yeah. Yeah. It really is more of a framework than it is, it's a set of principles rather than, hey, we include, these things. And so like RGP doesn't, it doesn't really, you know, it's not going to be one of these things that comes and goes depending on, what the evidence says or, new courses or whatever. Like it just, the principles behind RGP make sense and they're here to stay. And if you can work within those, that framework, you can be a great clinician, no matter what your tools are in your toolbox. But like you said, having that ability to kind of sift through things and be able to assess properly, is what sets you apart as a clinician.
Yeah, and it makes the work more fulfilling, right? For myself, and this is me, and that's why I think R2P was a good fit for me. And I think it can, if you're questioning chiropractic in general, and this is for, I guess, the students out there who are probably going through it and saying, is this really what I want to do? Expand, step out, look at different things and look at the body in a different way. And I think that you will start to respect the profession a little bit more and also respect the amount of impact that you can actually have on people's life. Yeah.
Talk to me a bit about your CBI. I don't know if all schools have a CBI, but it's a clinical based internship. And for our school here, that's basically your 10th and 11th quarter. You're essentially doing a preceptorship within the community. And then on your 12th quarter, you go out and do your full preceptorship. Tell me about how you kind of found the CBI that you eventually went to, or that not found, but what went into kind of making those decisions, and then your preceptorship being with Dr. Snell, just for future students that are looking into that sort of stuff.
Yeah, I think I definitely for my CBI experience, I definitely followed my bias. I was with Dr. Aaron Montgomery, who's also in Portland. And he also had a background in strength and conditioning as well. And I was just really drawn to that. I wanted to see, okay, if this is how I'm going to practice, how does this blend? How does this all work together? Because I didn't understand how it all went together. How do you, from a business perspective, how do you do all the things that you need to do to get paid as well, right? Where understanding, that I can help somebody move a little bit better here. I don't have to just have somebody come in and we go through exercises where it's a little bit more of a PT, feel, but I can also offer them benefit from a chiropractic standpoint in terms of manipulation. So I was trying to learn how to just blend everything together, and I felt like Dr. Montgomery and what he had done, he was as close to that in Portland that I was going to get to. And I got exactly that. I got to work with a handful of people. I got to work with, some you know, post low back, surgery patients in terms of, how can I help this person from a manual therapy standpoint, chiropractic standpoint, in terms of manipulation, but also, programming and building them up from a strength conditioning standpoint. Um, so it was good exposure for me. Then I transitioned in my last 3 months to Dr. Snell's office with Solution Sports and Spine, and I watched. I probably put my hands on less than 10 people when I was there. I watched a lot, and um, I was I was I was scribing. I was just doing notes, and um, I started to just and I started to get a better understanding of what Dr. Snell has talked on this podcast before about the neurocentric approach, um, and it was a true challenge for myself, because one, I'm scribing, I'm doing the notes, but I'm also trying to guess. I'm trying to guess based off of what this person has said in their history from a subjective standpoint, and as Dr. Snell goes through the assessment, you know, is this test going to be positive? Is this test going to be negative? You know, are we going to be able to modulate the pain with, different limb movements, things like that? Is this person going to respond to McKenzie? I got to play around with that, and I didn't get a lot of hands on, but my brain was on for the entirety of that, and it was. But R2P also gave me that opportunity to kind of jump into a world with Dr. Snell, who is, um, you know, just very good at what he does. In all aspects, whether that's communication, treatment, diagnostic, all of those things. Be able to step in the ring with him and understand what he's doing. Right, he might be doing a slump test and using the head to modulate symptoms in the low back, and he has a book schedule. He looks at me at the end of the visit. He says, "Do you know what I just did there?" And I said, "Yeah, I got it." And I get about 20 seconds to rattle off what I think is going on, and he goes, "Cool, got it." And then next person comes in. So it was like kind of it was almost like flashcards, right? Like just
Mhm.
like getting reps. It was all mental reps, um, which was hard getting into it at the end of the year, or like once I started after I had, passed boards and everything. But from a mental standpoint, I had the lenses that I was
Mhm.
starting to kind of cue in on. Um, so yeah, it was very different experience for my CBI, but I'm grateful for the mental side of things, because once I got
Right.
to practice, I didn't think quite as much, or I had the ability to think a little bit quicker than I think I would have in those previous 6 months.
Hmm. So, um, how is that different going from, so I'm CBIing at Dr. Montgomery's right now, and we do see a fair amount of patients. And I was saying to one of the other interns today, like, just being thrown straight into the fire and being forced to think, it's such a valuable experience, because that's what practice is going to be like. People are going to come in and you don't know what they're going to have. There's not a right answer at the end of this. They don't tell you ahead of time, hey, it's ankle pain, like, but I have a low back injury, like it's probably just going to be McKenzie and clear up, or something like that, right? So you have to go through the assessment and rely on your actual abilities. The downside to that is that you're limited by what it is that and what you can do. And so sometimes Dr. Montgomery come in and be like, "Hey, did you not try this thing here?" And be like, "No, I didn't even think about that," or something, right? And so when you're watching Dr. Snell, you don't, you get to see all these things in action. So, what's, what when if someone's deciding between the two, and they have an opportunity to go work for someone where they might not get to be treating patients, but they get to watch like a true master of work, what what would your thought process be as someone going into their preceptor looking at those two options?
Um, I mean, so yeah, I for me as well, like I was doing the notes, Dr. Snell, it was almost like we were both doing our own exam. We were both doing our own assessment. Now, my part of the objective assessment was based off of based off of what he was doing in his assessment, because I wasn't doing any hands-on work. But it was about, at the end of the visit, do my notes match up with his notes?
Hmm.
are we on the same page?
I see.
Like,
Okay.
is my brain, like, is my mindset or what I'm looking for, the way that I'm looking at this patient presentation, is it the same thing as the person that's working right here?
Right.
If I can match that up, which I'll tell you what, for the first month and a half, I probably didn't get better at, like, get into a good flow of it until until probably the last month. And then the challenge on top of that as well was to take those notes and then say, okay, cool, we have diagnosed this person with, whatever the diagnosis is. But now what's the next step?
Yeah.
Right? Because yeah, you got this person to come back, but they're still not 100%. Or, if we're looking at R2P, we're trying to bridge the gap, right? We're trying to bridge that gap between rehab and performance and, pain and performance.
Yeah.
So now as I move forward, Dr. Snell's looking at me like, what's your next step? And it's, oh, I'd go here. It's like, okay, that's fine, but are we on the same page of that? Is my head, am I going to take the same approach? And I don't have to, I have a different bag of tricks as well. That, I don't think there's a wrong way to go with it. But in that time I was learning and I just wanted to see if I was matching up with this person across from me.
Right. Yeah. So for those of you that are listening and you're at or going to a preceptor where you're not going to be treating, like, take notes, because obviously there's still a lot that you can do to learn and to progress your skills without actually putting your hands on a patient.
Yeah, I mean, yeah, like I said, I had probably treated about 10 patients in those 3 months. And that was an understanding when I first went in. And I, took it as a challenge. But I think, depends on where you want to go, right? Sometimes you got to push yourself a little bit, but that was a game that I kind of played with myself, and it made the experience more enjoyable, and it set me up for success. When I went out on my own, because took about 2 weeks after the new year for me to get my license, and then I was with Dr. Snell for those 2 weeks, and then after that it was all right, go get them. So
Switching gears a bit, when you were like thinking back to how you practice now, what are some classes in school, for maybe some of the earlier quarters listening? Like, what are some classes you wish you kind of took a little more seriously, paid a little more attention to now that could have, saved you some headaches treating today,
mm, that's a good one. I would say
besides biochemistry?
I would say that, right? Um, I would say honestly, anything that has to do with neuro, because that's kind of our little tangent that we kind of talked about before, like your neuro exam. And this is maybe where my bias again with my training with Dr. Snell is coming in, but um, your neuro exam, understanding, there is a reason for, is this sensory, is this motor, is this mix, those types of things, because if there is any discrepancy, side to side, bilaterally, wherever it may be, it's going to give you some insight as to what's going on, right? You were talking about thoracic pain, and
Hmm.
um, you know, how can I assess this, right? You have your hands, but we don't. There's not a ton of orthopedic exams to tell us exactly what's going on. But I can assess this person from a neuro standpoint. I can assess soft touch, things like that, right? Um, so like that to me, that's where I had to kind of go back and really say, okay, now when I'm doing all of this stuff, you know, yeah, okay, bicep reflexes, hyperreflexia, bicep reflex, but if you don't remember the nerve root, then it's not giving you a whole lot of information.
Hmm.
And that's the transition piece, right? So you get your flow down, which we had talked about, get your flow down, get your flow down, get your flow down. But now, what is my flow actually telling me? How am I
Yeah.
actually tying all of these pieces together? Um, and that's again, it's a different lens. It's a part of a good exam, but it's a different lens to look at the body to really understand. What kind of tissue am I dealing with? What's talking to me in this situation from a pain perspective?
Yeah. Yeah. I think that's super important. A lot of those classes that, I just, can only speak from experience, but you just kind of go through the classes. You're like, yeah, neuro exam, I got it. Like,
Mhm.
how hard is it to muscle test, a bicep or whatever? But, as I'm going through this internship with Dr. Montgomery and I'm realizing like, oh, this can get really specific. And those little details matter, especially, and not just for like, hey, I tested their, C7 myotome and it was a little weak. Um, like, sure, that tells you something about what's going on in the body, but at the same time, like, that's a great audit to use as well, you know, as you're
Yeah.
going through things to show the patient, hey, look, this was weak. You remember when this was, your left side was stronger than your right side. And all we went and did was just gave yourself a double chin or did some, an opener or something like that. And we retested and now all of a sudden you're stronger. Like, we weren't
Well,
doing any, you know,
and with that, Connor, like you're hitting a bullseye, right? Like like the specificity that you were talking about, like, oh, this can get really specific. That's where what can seem like a very overwhelming thing being all the way out here, you can actually start to narrow in on some specific things and you can hit a bullseye, um,
mhm,
and make your life easier, right?
yeah,
And that's why I was saying, doing a good neuro exam, those types of things, like, what you practice your reflexes, the day before the exam, and you make sure that you can do all the things right.
yeah,
Um, make sure you can pass boards, um, but you can actually, you can hit a bullseye if you do a thorough enough, exam, you know, orthopedically and from, a neuro standpoint. Um,
totally.
I think one of the first interviews that we did on here, um, was with Ben Ramos, and I think I was maybe it was in like Q7 or 8, and he said, and I think about this every once in a while, he said, everything that you learn in school is enough to help people. Like, he's like,
Mhm,
you can go out and you can do, the SFMAs and the neurodynamics and the McKenzies, and like those things will make your life easier for sure. But if you get really good at the basics, um, the schools, they teach you enough. They teach you enough to be able to bullseye. You just have to be able to tie all the pieces, put all the pieces together,
right.
be able to understand it, and then make your treatment decision after that.
Yeah,
I'm realizing that that is more and more true as I go through. Right? You just
yeah,
get good at the principles. You even said it with R2P earlier. It's a set of principles, right? Your assessment has some level of principles as well. From an orthopedic, range of motion, orthopedic, neuro, palpation perspective, right? You do those things in all of your with all of your patients.
yeah, yeah. That's very true. Yeah, we do have all the tools we need already. Um, it's just about how you apply them, how you
Ma-
assess for them.
yeah, mastery.
Yeah.
Mhm.
Um, I'm getting the sense for one of the questions we have here that Dr. Snow was your mentor. But were there any other mentors you had going through Cairo school? And what was one of the biggest lessons you got from them? And it can't be Corey Bailey.
Yeah. Um, I had one person who, I think you kind of you aim for the top in these situations. One person who I just like absolutely loved to hear talk was Bo Beard. Um,
Mm,
he was I was always blown away when I heard Bo. He was one of those people, and I have a bit of an ego, and but when I get around somebody and I just want to shut up and not say anything, that's how I know I'm in like good company. I'm in the right place. Like when I
yeah,
feel when I don't necessarily feel like I have something to add to a conversation because that's the level of, the conversation at the table, like um that's when I know I'm in good company. I'm like, I'm gonna follow this person. Um
yeah,
and I think just listening, I got a lot from his podcasts with some of his weeks in review, because where I felt the least, where I struggle with the most is from a diagnostic standpoint, actually being able to put a name to what's going on with this person. I might be able to tell you, yeah, you have knee pain that's caused by, something, some sort of irritation in your low back, whatever that may be, but to be able to actually, put a word on that,
Yeah.
those were the little things that, listening to that, they like, opened my eyes, and I was like, it just opened my eyes, and I have respect, for anybody who can put any sort of focus on my ignorance. If you can shine a light on my ignorance, then I have a lot of respect for you. Because and that's mostly my ego talking, but at the same time, like, that is truly how I feel. Like, so yeah, I got a lot from him, and I say that too because um I was fortunate enough during COVID where things were virtual, where things started to be offered more like from a virtual standpoint. And I remember taking Bo's first running course, and I had no idea what this dude was talking about. All of these different like ways to assess and all of this. And it opened my eyes to just it just opened my eyes to really like where chiropractic can go. Um,
Mm,
oh, this is how, and now I'm starting to get a better idea. Oh, this is how I can potentially um, blend, what I had from a CSCS perspective into like chiropractic. Um, so yeah, um, that was like a big piece of me where I just saw where it could go. I just had to find the people to teach me how to tie all this stuff together. Um, so yeah.
cool. Yeah, I love that. Yeah, Bose just blows me away in many different ways. Just the amount of stuff that he's able to get done
Yeah,
and just be at the highest level possible as a clinician at the same time. It's just, yeah,
it's special, man. It's special.
yeah,
And now, and I think too, you respect it as a student, and then you step out um, and you become a business person, like, on top of a clinician, and you go, oh, like, I thought being a student was hard. I thought that treating was just the thing. It's like, no, you know what I'm going to spend the rest of my night doing? I got all my chart notes to do. And it's 6 o'clock
hmm
already. I haven't even made dinner yet. All of these different things that when
on
you,
top of being a father.
yeah, right, all of those things. It's just like,
Yeah,
you as you get older, you just have, and as you progress through this profession, you have a lot more respect for those types of people. So outside of Dr. Snell, that was, my first little glimpse as to like what this could really be. So um
yeah,
COVID was COVID, but I'm fortunate enough that, in those moments we had those virtual opportunities and we could have those talks. So it was cool.
absolutely. Yeah. Um, going through school, did you take many seminars going through school?
Um, yeah, I feel like so I did a Dan John course, which that one was really cool too, simplifying some of the principles that I had, some of the ideas I had behind strength. I took Dr. Rich Ohm's strength training course down in Grants Pass a couple years ago. Plan on taking his second one here this summer. Um, never
Anything you'd recommend for students to take? Um, that are just looking to, I feel like there's always that battle. Should I take it now and kind of get my mindset into that kind of, lens, or should I hold off till I'm treating patients and, maybe risk not, being stuck in my ways a bit, I found I took a lot before I treated patients, and a lot of it I completely forget. And now I'm taking courses. And I'm like, wow, this is so much more valuable. At the same time, though, I was exposed to so many cool people early on that I'm like, coming into treating patients and stuff. I'm like, a little bit of a different mindset.
Yeah, and I've heard of a couple people who have, gone that same route, and I feel like there's always a mixed bag of responses between, I should have waited, or um, I should have waited, or should have, done this earlier, whatever it may be. Uh, I would say one, that still impacts me, and I know that people get this one a lot, but if you're in a space where you just don't really know, you're not really sure what you're looking for, I think SFMA is a great place to start. And I
Mhm.
say that even too as a strength, as a strength coach, in terms of I could tell you what a good squat looks like. Um, I could tell you what a good deadlift looks like, all of those things, but I couldn't tell you, and I could maybe fix it, maybe fix a squat by putting a band around the knees or something like that. You know what I mean? I was using those sort of tools and tricks to, get better outcomes. But I couldn't actually sit there and say that, oh, this your squat is like this because, because of this functional limitation, whether that is, a mobility dysfunction or a stability motor control dysfunction. Like I didn't have those tools.
Yeah.
Those things sometimes in practice, and I've found, are a little harder to master, because there's already a lot going on. Um, but if you're looking to, learn just how the body moves and what expectations, from a movement standpoint, range of motion, things like that at certain joints, what you're looking for there, you can start to tie the pieces together a little bit more, right? Um, if you don't
Sure.
know, you can sit there and say, oh, that person, their thoracic mobility is, not where it needs to be. It's like, okay, cool. Um, but where should it be?
Yeah.
What should it look like? And also too, how is that thoracic mobility? How is that affecting whatever it is that you're looking at?
Right.
Um,
Right.
but again, we're talking about big picture here. We're talking about, you know, tying everything together. Because that's the goal. The goal is to be able to tie everything together, make your life easier, hit those bullseyes.
Yeah.
Um, because yeah, that's where you can get to a point where you can see a lot of patients and get a lot of really good outcomes. But if you don't have that, and you spend 40 hours of your week, and you're seeing 50 patients a week, and you're kind of just guessing at things, it's people will feel better, but you know what, it's gonna make your life harder. And
Yeah.
you're gonna have a lot of days where you leave the office and you're not gonna feel super great about yourself.
Yeah.
um, which is also a part of the process as well.
Totally. Yeah. I love that answer. I thought SMA was a a game changing course, and like not even a whole lot of like I feel like most courses are, barring, I don't find neurocentric approach too dissimilar from SFMA, because I feel like they both, give you some pretty amazing ways to assess the body, and then some tools on treatment, but which end up, with the NCA, the assessment and the treatment aren't aren't really different things for the most part.
Yeah, and that was, from a neuro perspective, NCA was a huge part of it for me. Being able to understand, okay, what are we actually looking at here with all of these
Yeah.
specific things? And, um, somebody might have, from an SFMA perspective, somebody might have a, dysfunctional, painful, you know, upper extremity one or upper extremity two, pattern. Um, but I can say, okay, cool, this might be the joint, this might be thoracic mobility, it might be scapular stability, whatever it may be, but it also could be due to some level of neurotension, right?
Yeah.
Now that's the blending, that's the tying the pieces together that I was kind of talking about. So and then you start to see, then you start to see trends, start to see, somebody comes in with something else, you assess and you go, "Ah, it is that. It is that.
Yeah.
It was that thing again.
Yeah.
Cool." Um, and that's the one where you walk out, I mentioned there's a lot of days where you walk out of the office and you don't feel super great about yourself, but those are the days where you walk out of the office and you go, I learned something today. I
Yeah.
saw something, like I saw it, I learned it, and you can give yourself a pat on the back. Um, Now you just wish that every patient walks in, and then somebody walks in with the same pattern, and the next time it's not that, and then you go, okay, well, we gotta start over again. But you know,
Yeah,
you got to add up the good days, man. You got to add up the good days.
yeah, absolutely. Yeah, you got to make them count.
Yeah.
I'd probably add in there, just because I recently just took it online, was fix your own back, and especially for a student like this is, it was such a crazy good course. Like I was just like, wow, that's
Yeah.
about as comprehensive gets
I
for
mean,
looking at things.
shout out to Dr. Snell. I mean, he's still always down. I know that he talked to you guys last week about some of that stuff at UWS, but that was a big one for me as well in terms of, you know, that was a good one in terms of being able to organize my thoughts, you know. Because again, you know, I was talking about my preceptor with him. All right, this person responded to Mackenzie extensions, whatever it may be. But now what? You know, where do you go
Yeah,
next? Right. And that is a way, it's a good way to organize your thoughts and get a especially for like a young doc, um, to take those next steps and be able to see somebody, you know, 5 6 times for, you know, something that could be severe low back pain, and be able to progress them, and get them closer to their goals. But yeah, um, that's the thing is, you know, sometimes when you run out of bags of tricks, you know, you get to that sixth visit and, you know, you're kind of talking about, you know, potentially, you know, discharging them, you know, pushing things out a little bit further, see if, you know, the work that you've done holds water. But at least you have the ability to see this person for 6 visits.
yeah,
And because sometimes we undertreat, um, when we're new to it. Sometimes we undertreat because we don't really know where else to go,
yeah,
you know. And I don't
yeah.
want you to just come in and rub muscles and, you know, pop bones. It's like, okay, well, I've kind of exceeded my limits here, so I guess we're done here, right?
Yeah,
Yeah.
yeah. Last question for you.
Cool.
If you could go back and talk to your first quarter self, what advice would you give yourself? If you give yourself any.
Just be more open, man. I was just yeah, moving to Portland, you know, this is a little more personal, but like moving to Portland, you know, I'd moved from Pennsylvania to Portland and I didn't know anybody. Kind of came out here to, you know, restart in a sense and um, you know, enjoy the process. I was way too serious. And I think that's something that I've um enjoyed about myself a little bit more, and even the work that I do, and I find it more fulfilling, but it's just, you know, kind of playing a little bit more. When I moved out here, I was still very much in my player coach mindset. You know, everything was very serious, you know, classroom was game time, and, you know, that's what
Yeah,
I, um, so I would just tell myself to, you know, play more and, you know, just enjoy it. It's not going to be perfect, even if you try super hard. So you might as well enjoy it while you're doing it.
awesome. Well, I appreciate you coming on the podcast, man. That was a lot of fun.
It
I
was
hope
good to
you had
see
some
you.
fun too.
It's been a minute.
It, yeah, it has, and so I got to get out there and watch you back in action, because I think it's been half a year since I've seen you
Yeah,
trading now.
I'm a different person.
I know.
It's we're you know constantly changing. I always tell patients, you know, if we see each other like 3 or 4 months down the road, they walk in and, you know, they might have something similar to what they had before, and I'll always say, and I always look at them and they say, hey, I just want you to know I'm better than I was the last time you saw me. Um, you know, said I love that about, you know, you come in and you get like, you know, anytime there's some hiatus in, you know, treating a past patient, you know, I always tell them
Yeah,
like better than the last time like we saw each other. I said, let's get after this, you know.
yeah,
Because they might come in with the same thing, but I'm better and I'm gonna look at it from a different way. And, you know, it could be the same thing, but I'm at least gonna try to dive a little bit deeper, challenge myself to, you know, continue to do all of those things. So yeah, man. But
I
come
listen to
on out.
podcasts. I will. Yeah, I'm gonna send you a text after this. We'll set something up.
All right.
Just something to end on. I was listening to a podcast today, and one of them brought up a quote. it's like a man never enters the same river twice, or a man can't enter the same river twice because one, he's never the same man, and that river's never the same.
We're always changing. I don't. It adds up over time. It's slow, but it adds up over time, man. So I'm excited. Yeah, come on out, man, and we'll, you can see things a little bit differently. Ask questions. You ask more questions than anybody I know. So, if it's gonna come to me getting better, I feel like every time I talk to you, I get better because you always ask questions that I don't have the answers to.
Gets you in trouble sometimes.
Yeah,
Starting to find out.
don't stop. Don't stop. I got your back. I got your back.
I appreciate that, and I appreciate you, man. Thanks for coming on, and I hope all you guys listening at home enjoyed the episode.
Yeah, appreciate you, Connor. Talk to you soon, brother.
Talk to you soon.